Dr.
Well, here
Bob?
it is in September, and pollen has already been in the air. It's the fall pollen. The most common fall pollen is ragweed. Now, ragweed's a very unusual allergy-producing plant. Every day, a ragweed plant will put out 1 million pollen grains. And so you usually will see fields of ragweed. It's usually in an area where man has interfered with the ground. So we've got longer seasons now. So people with ragweed hay fever will have longer problems with stuffy nose, runny nose, sneezing, and itchy eyes. Remember that the fall pollen can also cause allergy lung problems, so it can cause asthma. And in the fall, not only is there pollen, but there's also mold that gets in the air. The heating system begins to come on and we begin to have dust allergy. So it's a real allergy time of the year. It's a time where there are lots of infections. What can you do for allergies? Well, it's very difficult to avoid pollen because the ragweed pollen will spread as far as 200 to 300 miles. So if you're even near a ragweed patch, you know that ragweed is going to find its way to you. There are intranasal steroid sprays and there are antihistamines. They're excellent medications. The first thing you need to do is make sure that you know that that's the diagnosis you have. You may have to have allergy skin testing. If you're having allergy lung problems, there are bronchodilators, and if your asthma is significant, there are inhalers that will help control the inflammation that occurs with asthma. So know that medications are good. Don't let ragweed hay fever and ragweed problems control the fall of the year for you. See your doctor. He'll put you on a good program. And now questions from you, the viewer. Dr. Bob, what is gouty arthritis? Well, gouty arthritis is where uric acid crystals, and uric acid floats around in our bloodstream. If it gets too high, some of the uric acid crystals can deposit themselves inside of a joint, and it irritates the lining of the joints and causes painful, swollen joints. The great toe, the big toe, is the most dramatic place to get gouty arthritis, but it can be in essentially all joints. Usually what we do is we treat the inflammation of the arthritis first. We calm that down, and then we see what the uric acid is, and we begin to take medications that will lower the uric acid level, and usually that will mean we have less problems with gouty arthritis attacks. So if you've got arthritis, see your doctor. He'll identify whether it's rheumatoid, osteoarthritis, some of the other arthritises like gouty arthritis, and know that there's excellent treatment. And now back to everybody. It's the fall of the year. Have fun outside, but know that pollen has a chance of making people have allergic rhinitis and asthma.
Thank you.